a good way to remember. So if I'm standing in the anatomical position, like this, so the lateral side is closer to my head. So the lateral side is going to be drained by which vein? The one that is closer to the head, cephalic. And the medial side is towards my base. Towards the base. So I will call it cephalic. Alright? I'm not saying that this is the origin of the words. I'm not sure where it is the origin of the words, but this is a way I'm using for me to remember. Alright, which one is drained through cephalic, which one is drained through basilic. The basilic vein drains into my brachial vein. So it goes up, travels, and it's going to be drained into my brachial vein. Compared to the cephalic vein is going to go up and drain closer to the head. So it's going to be draining up in here in my axillary vein. So again, two superficial veins that we're looking at in the forearm and arm. One that travels on the outer aspect, on the lateral aspect. This is my cephalic. One that travels on the medial aspect. This would be basilic. Cephalic drains up close to the head. It's cephalic, so it drains up close to the head. Is going to be the axillary vein. It drains up into the axillary vein. Compared to the basilic, it starts with B, it drains into my brachial vein. Again, those are mnemonics for you to remember. Alright? So basilic drains into brachial. Cephalic drains into axillary. The one that she was trying to find is a connection here between cephalic and the basilic. The most common site that we're going to be looking for is the famous one. This is my median cubital vein, which is a connection between the cephalic and the basilic veins. Alright? This is the one that she was trying to find. We've got many other veins, many other superficial veins. So you can see veins under your skin. Those are superficial veins. Those are superficial veins. So we might go in here and take the blood sample. In some cases, if we couldn't find a good vein to withdraw blood from in the anterior aspect of the scalp.
Alright, so since the blood goes up, why does it stick needle upwards? Does that make sense? When the blood goes up, why does it stick the needle up?
Yeah, the blood doesn't flow at a very high pressure anyways in my veins. But I should be aware of the flow of the arteries. I'm not that concerned with the flowing vein because simply it's as we're going to learn, it's a capacitant vessel. It has a very low pressure of blood. So it will stick it up because it has more room for the needle to travel in. Alright, to not injure other tissues. Because she finds the tracks that she's gonna be moving the needle through. This is why she's moving it up. But in other veins, you can move down or up. It's gonna be different according to the specific vein, not according to the blood flow.
And like I'm moved, and it's like I was moved, and then the blood stopped, like it stopped flowing in the needle thing.
Because it was not inserted as it should be. So the needle is not inserted to the inside. So whenever you moved, you dislodge it out of your vein. You move it out of the vein.
It doesn't like puncture and makes it like stop or
it will be stopped anyway. It's too tiny, so it's gonna be immediately stopped by your platelets. It should immediately get sealed, and the bleeding will stop by forming a platelet flood, which will take a few seconds. Questions? So again, what are the two superficial veins that will be draining my upper, that will be very prominent in my upper limb? Those are my the lateral aspect cephalic. My medial aspect is going to be basilic. And the connection between this will be my medial cubital vein. Medial cubital vein. All right. What's going to happen to the blood that you're going to get from the superficial structures of the upper limbs? It will be, if you're getting the blood from your basilic vein, it's going to drain into the brachial vein, and the brachial vein drains into the axillary vein. Axillary vein moves up to drain into the subclavian. Subclavian will drain into my brachiocephalic. Brachiocephalic will drain to superior vena cava, to my right atrium, to the right ventricle, and so on. If you are getting the blood from my lateral aspect now, that lateral aspect of the forearm is going to pass from cephalic vein up to my axillary vein, and then from the axillary vein it travels to subclavian, then from subclavian it travels to brachiocephalic, superior vena cava to right atrium. All right, questions? All right, so let's move on to the venous drainage of my abdominal organs. So if this is my lower esophagus, this is the stomach in here. This would be the small intestine. This would be my large intestine. This would be my liver. Like this. This would be my spleen. If I will be moving the liver away a little to give us room to grow. Alright, so the liver is supposed to be here. So I'm going to tell him. Alright. Alright, so what do you expect the name will going to be given to the veins that will be draining the stomach? Gastric veins. So you've got gastric veins draining different parts of the stomach, and you're going to have parts of the lower esophagus also drained by those gastric veins. What do you think is going to be the name of my vein that drains my spleen? Splenic vein. So you're going to have splenic vein. What do you think is going to be the name of the veins that drains from the small intestine and part of the large intestine? What do we call the arteries that will be supplying the small intestine and part of the large intestine? This will be my superior mesenteric artery, right? So what do you expect the name of the veins that drains the small intestine and part of the large intestine? This would be my superior mesenteric vein, right? Superior mesenteric vein. What do you think the name of the vein that's going to be draining my remaining part of the large intestine? This is my superior mesenteric. And this would be here, this would be my inferior mesenteric happen to the blood coming from those organs after it gets drained through those major veins? All the blood coming from those organs need to be drained into your liver. So the veins that will be draining all those organs into your liver, this will be my portal hepatic vein, or simply speaking, portal vein. Why would you drain all the blood from the spleen, from the stomach, from the intestine, large and small intestine, to the liver? For it to be filtered. Because this is an entrance to the inside of your body. So everything that you are eating is passing from your small intestine to your blood, and then from the blood, it needs to be filtered. It needs to be metabolized in the liver cells for it to be ready to get delivered to the other organs. You cannot just simply get something directly from your small intestine and deliver it to your heart. You cannot just get something directly from your small intestine or large intestine and deliver it to your brain. You need to metabolize and detoxify anything that's going to be passing from those organs in the liver cells first. So what is the vessel? Again, that drains all those organs into the liver. This is my hepatic portal vein. It's my portal vein. What's going to happen? The blood will pass into small sinuses into the liver, and the liver cells, the hepatocytes, will be metabolizing, detoxifying those nutrients and toxins passing from the different abdominal organs. After you detoxify those toxins, after you metabolize the nutrients, now the blood is ready to be delivered to the systemic circulation. So the blood is going to be drained out of the liver to a vessel in here. This is my inferior vena. And this would be my common hepatic vein. This is my common hepatic vein. Why is it common hepatic vein? Because we're going to have two smaller ones that will fuse and will form the common hepatic vein. So that's why we're going to call it common hepatic vein. So we're going to get one from the right, one from the left lobes of the liver. When they fuse together, I will call it my common hepatic vein. Then from the common hepatic vein, this blood is going to be draining into my inferior vena cava, which will travel up to my right atrium, and then from the right atrium to the right ventricle, to the lungs, back from the lungs, and so on. All right? What is the organ that will not be drained into your liver and located in your abdomen? Very important is to remember, it's going to be my kidneys. Kidneys will drain separately and directly into the inferior vena cava by my renal veins. So renal veins will drain the right and left kidneys directly into my inferior vena cava. Why do you think?
Because they're also filtering. The liver is filtering.
But they are filtering different stuff.
Right. That's why I think.
Maybe since it's already filtering, it doesn't need to be filtered again.
So those are totally different things that you filter. So the type of metabolism that takes place in the liver is totally different than the one that takes place in the kidney. So it's not a matter of overlap. Like, there is no overlap in terms of function. So you go either to the liver or to the kidney, no. You have to go to the liver and to the kidney.
So when the blood travels to the liver, after it goes to the common hepatic vein?
Common hepatic vein drains. It carries the blood from the liver to the inferior vena cava.
Okay, so it goes back this way.
To go back to the right vein. Yes. But the one that drains those abdominal organs into the liver, this is my hepatic portal vein. So this is portal, this is common.
And then where do the kidneys go?
They drain by renal veins directly into my inferior vena cava. This is my inferior vena cava on here. This is my inferior vena cava. Alright? So why do you think? I don't want my kidneys to be affected by any problem in the liver. So for example, if I have been drinking alcohol for the last 30 years, so what's going to happen to my liver? It will be destroyed. I will have what we call liver cirrhosis or hepatic. This is how my liver will look like. Alright, and the problem here with the hepatic cirrhosis, if you can turn off the lights, please. You see, this is the cirrhosis. This is the cirrhosis that takes place. This is the normal liver tissue, and this is cirrhosis. This is a growth anatomy. This is a growth pathology. This is how the liver looks like. So my problem now is a disturbance in the architect of my liver. So my liver cells are able to regenerate, but the problem is I have lost the normal architect. I've lost the normal shape of my liver. And I did build up fibrous bands inside. So what's going to happen inside my liver? Those clusters I'm building,
They're gonna cause blockage.
they will be compressing my hepatic sinuses. I'm compressing the veins inside the liver. So if I'm compressing the veins, what's going to happen to the blood coming into my liver? Will I have stagnation? Or will I be totally fine? What's going to happen to the pressure here in my portal vein? Increase. So if, for example, you've got 5 accidents on 5 different exits on the 95, will you take more or less time? Do you have more or less congestion on the 95? More congestion. Same here. I blocked all the pathways for the blood to get into the liver by destroying the shape of the liver. So what's going to happen? The blood pressure in my portal vein will be increased. So what's going to happen to the blood pressure in my gastric veins? Increase. And spleen? Increase. Small intestine, large intestine, all will be increased. So what if the kidneys? So let's imagine this is not something that takes place. So let's imagine my kidneys are also draining in here. If my kidneys are also draining in the liver and the liver is destroyed, what's going to happen? I will have uremia and I will die within a week. As if I have totally normal kidney, don't have any problem with the kidney, but because I have liver problem, my kidneys will not function because I need a high pressure for me to push the blood into the kidney, and I need low pressure in my venous system to drain this blood out. If you can't drain the blood out of the kidney, what's going to happen? You won't get any more blood in. So if the capacity of this classroom is 100 persons, let's say, and I've already filled it, will I be able to get any more from outside? No. See, so if I'm not draining, there will be stagnation in the organ, and as a result, no more blood is capable to get in my kidney. And if no blood is getting into the kidney, my kidney will not filter the blood. So what's going to happen to the toxins? They will build up. As if I did have a renal failure. Do I have any problem with the kidney? No. That's why we don't drain the kidneys in the liver, because I don't have to have a problem with the kidney if I've got a problem with the liver. So you can have a liver transplant separately without having to do anything with your kidneys. All right. So what's going to happen? What's going to happen here? To those veins, again, they will be congested. One of the late stages here for liver cirrhosis is going to be the development of varices. Varices in the lower esophagus. So those are dilated veins of the lower esophagus and the cardia of my stomach, the upper part of the stomach in here. And this is one of the latest stages. Here. So you see what happens? I've got congestion in the portal circulation. Blood builds up. It will be dilating the vessels in the lower esophagus and the stomach. So what's going to happen to those dilated vessels? This is the varices. They will rupture, and I will have hemolysis. I will be vomiting blood. So how are we going to be treating this bleeding? You're going to be just treating like any varicose veins, like any veins. You're going to be putting a glue inside. This is what we call sclerotherapy. Something like the glue. We're going to be injecting inside the vein for them to shrink, for it to shrink. Sclerotherapy. So let me show you sclerotherapy. So I go inside of the veins, and I will be injecting the agent. It is something like a super glue. Right, into the veins for them to be obliterated. We don't use, of course, super glue. So it is just silver. Alright? That is close enough. Alright, so questions? Again, while we mention all this, just for you to remember that stomach, spleen, stool, and large intestines will be all drained first into the liver. So remember, gastric veins, splenic vein, superior mesenteric, inferior mesenteric, all will drain into my hepatic portal vein that drains into the liver, and then from the liver you're going to be draining all the blood out through the common hepatic veins that travels up to the right atrium here through the inferior vena. All right, let's have a look now at the venous drainage of the lower left.
You let us know before you're about to,
Yeah, I will leave it. I will leave it. I will not be taking it. It's not completed. We're gonna keep adding to it. Alright, so what do you think is gonna be the veins? The veins, the deep structures of the anterior aspect of my leg.
Interior femoral.
Anterior tibial vein. Alright? And what do you think is going to be the veins that brings the posterior tibial vein? And the posterior tibial vein with the anterior tibial vein that goes for draining to the veins that passes and travels in the posterior aspect of the knee. This is what we're going to call posterior vein. And then off the tibial vein, you're going to travel up in the thighs. This is going to go. And then the femoral vein is going to be passing below this ligament. In one ligament, it will become external iliac vein. Exactly. External iliac vein. External iliac vein will meet a vein coming from the inside of the pelvis. What do you think? We're going to name this vein internal iliac vein. And guess what vein will I be following by internal iliac and external iliac veins? Common iliac vein. See? And then right common iliac and left common iliac veins will fuse together and will drain to the common veins and travels up to the right atrium. This is where the inferior vena cava will start. Alright, so again, venous drainage. Anterior aspect of the leg is going to be drained to anterior tibial. Posterior aspect is going to be posterior tibial. Both will drain to vein passes posterior to the knee. This is mine. Upper iliac vein travels up in the thigh. Passing in the thigh would be called femoral vein. Femoral will pass below the inguinal ligament. This would be external iliac vein, and external iliac will meet a vein coming from the inside of the pelvis, so we're going to call it internal iliac. Both will form together and drain into common iliac vein. Right common iliac, left common iliac will drain to common veins that travels up to the right atrium. This is mine. Inferior vena cava, and the inferior vena cava can drain the blood which is the right atrium, passes from the lungs, from the lungs back to the heart. Alright? So now your turn. So get a separate sheet here, piece of paper, and mentions the pathway of the blood. Mentions the blood pathway that it will travel, passing from cephalic veins. So I will start with an easy one, and then we'll go to more difficult ones. So we can start with right cephalic vein. And we're going to go to right dorsalis pedis arch. So, again, the pathway I want you to write down is you're starting from right cephalic vein, and you're gonna go to right dorsalis pulsar. So what I need to write down, you need to mention every single vessel that you're gonna be passing through in this pathway. So all the vessels that you're gonna be passing through, all the chambers of the heart that you're gonna be passing through, all the valves that you're gonna be passing through. All right. So I'll give you 10 minutes. So we're starting from right cephalic, yeah, as if it's coming from the head or related to the head, but actually it's not. That's the right cephalic vein, you remember? Cephalic vein, where is it coming from? This outer superficial structures. Yeah, you start from right cephalic vein and you end up in the right dorsalis pixel. So each time you stop, ask yourself, what is my next station? Each time you find yourself confused, ask yourself, what is my next step? What is the next vein? Or what is the next artery I need to get in? Only think of one vessel at a time. Yes.
I just want to know about that. I don't know if I'm able to correctly.
What did you say?
Okay, this is this is what I found. That's right here. I've been on here.
Right? Cephalic vein. How did you get here?
Because this is the
Cephalic drains into? Remember? Cephalic drains is the exit. Drains into the exit.
How does it go into the auxiliary?
That's the question.
Oh, you're talking about the. Oh, I get it. Right.
It's the cephalic vein in the forearm.
Right. Okay, I think it.
Right? Good?
It's no. So what was the brain? What was the brain? The two brains that was called.
Internal jugular?
Oh, jugular. Gotcha.
Those are the veins of the brain.
Okay.
Internal carotid, those are the arches.
Okay.
And that was the question I was asking. Was the question about? You said the pathway of the cephalic, which is on the outside, right, goes to
Exit.
see where it's auxiliary on the inside. You said break.
Yeah, it will join the axillary before it becomes something.
Okay.
See? So you need to measure all the details, so I will be putting all the information that you need to put on a similar question on your test. But actually, I won't be doing the same thing over and over, so because there will be repeated parts. I don't have to mention the details every time when we do an example. So we're going to be doing a few examples in the next classes. All right, to review them. All right, so this is the one that you're going to use as your reference on how you answer the part. All right, so right axillary vein, and then right axillary will bring into my right subclavian vein. Right subclavian gonna be drained into my right brachiocephalic vein. Right brachiocephalic vein. And then right brachiocephalic vein drains into my
Superior.
superior vena. Now I have reached the heart.
Okay.
So I get superior vena atrium. And then I will pass from the right atrium to the right ventricle, passing through my passing through my tricuspid valve, and then right ventricle will pump the blood through the pulmonary semilunar valve, to get to the pulmonary trunk, and then from the pulmonary trunk, you're going to pass to the pulmonary artery, any artery, so either right or left, and then I will get to the lungs, and then you're going to drain the lung into your pulmonary veins. That drains the blood into my left atrium. That will allow the blood to travel down from the left atrium to the left ventricle, passing through here, my mitral valve. The blood will then be pumped out from the left ventricle through my aortic semilunar valve. And then I will start tapping in the arterial systemic circulation. So you're going to pass a descending aorta, aortic arc, here, plus ascending arc, then descending aorta, then you pass through the diaphragm, so it becomes abdominal aorta. Usually you need to ask yourself, whenever you are about to get out of the left ventricle, you need to have a look back to what is my destination, where I am willing to go at this point. When you are about to leave the heart, you need to keep in the back of your mind what is your destination. Where am I willing to reach? All right, so I know already that I'm going down to the lower lung. So there is no way I can reach my lower lung by passing here through any of those branches, right? Right common carotid or left common carotid or subclavian artery or whatever branch coming out of the aortic arch. So you need to keep this in mind. When you are about to leave the left ventricle, you need to have a look back at where I am willing to get to. So I'm going to the lower sagittarius arch, so this means I am in the foot. So I will go down, arch, descending, abdominal, and then another look back. So I'm going to the right or left? Right. So you need to take right, common, iliac, artery. And you see here, right common iliac, why I didn't mention anything in between, why didn't I mention celiac trunk, renal artery? You didn't pass through them. You didn't pass through those vessels to mention them. You're only mentioning the vessels that you're going to be passing through. if I did get out through the celiac trunk, I won't get to my foot. So I need to keep going. Abdominal aorta, right common iliac, and then right external iliac artery. After right external iliac, you're going to pass to right femoral artery. And then after you pass through right femoral artery, you're going to pass through right popliteal. Then divide and gives a branch that travels on the anterior aspect of the leg. This would be my right anterior tibial artery. And then right anterior tibial artery as a continuation of this vessel in the foot, it's going to be my right dorsalis pedis artery. Right? We're going to be trying much more difficult exercises next time. This is our first level of questions of this type. When we integrate the brain circulation, the heart circulation, it's going to get more complicated next time. All right, so we're going to have a long weekend this weekend. All right, so it's a good time for you to study the arteries, veins. Try to practice them, repeat them over and over for you to be familiar with the pathway. We're going to be trying to answer many exercises next time. All right?
So on the test, we just list them. Do we have to draw?
You don't have to draw, but some people will find it easier to draw, so I will give you a silhouette, body silhouette, as a diagram. If you want to draw, you can draw. But what's going to be graded is only what you're going to be listed, not the draw.
So we'll have like a blank space like right there to just write.
So I will give you a like what's drawn by the black marker. This is what appears on your incision. So something like this. The black what I did draw is black. Like that outer shape of it.
Will you count if you don't put right or left?
Why?
Because that's what I don't fix that. I know.
Like, yeah, so we're just learning. Now we're just learning. It's not a problem if you make it, if you didn't make a mistake or if you didn't get it for the first time. This is fine. We're gonna be answering many of them. But on the test, why won't you put right or left? Alright, so it's right. Sometimes it won't make any difference, but for some other pathways, it will make a great difference because when you move to the right, for example, if I told you I want to go to right internal carotid artery. Alright, so let's start from the left ventricle, and I want to go to the right internal carotid. So what's going to be the pathway?
You'll go through the aorta.
So I'm starting from left ventricle. So you see on here, this is my left ventricle. I go up, ascending,
Then
arch. If I didn't pay attention whether I'm going right or left, I would be missing one vessel here. So if I go to the left rather than the right, so I will go left common carotid, left internal iliac to the brain. But my destination is right, so you miss 1 point in here. Sometimes it's going to make a difference, sometimes it won't make a major difference, but why wouldn't you pay attention to this point? Alright? Again, it appears to be somehow complicated, but actually it's not. Everything is logical, and you need just to practice. When you keep practicing, it's gonna become easier and easier. All right. Questions?
I'm kind of getting lost when you start drawing in the middle.
The heart?
Mm-hmm.
Yeah. So this is purely cardiac system. So remember, this is the circulation that we've discussed the last couple of times. Remember, we did have superior vena cava, inferior vena cava, and both are draining into my right atrium. You remember this? And then right atrium drains into my right ventricle. Then right ventricle is pumping the blood out to the lungs through the pulmonary trunk. And then the pulmonary trunk divides, do you remember, to the lungs. Yes? And then you're gonna get the blood back, but this time it's gonna be oxygenated from the lungs to my here. This would be my pulmonary veins. This will bring the blood into my left atrium that moves down from the left atrium to the left ventricle, and then will be pumped out into my aorta. And the first part of the aorta, this is from the previous chapter. This is from the previous chapter. Here, the new chapter, you start here, ascending. From the left ventricle, you go descending aorta, arm, descending, abdominal, external, common, external, femoral, popliteal, anterotibial, and dorsalis pubis. Alright, so this might be confusing, but actually here this is so simple. It's just a repetition of what we mentioned before. So what I like about this question is that it tests you on both chapters. It tests you on the cardiac part and the vascular part.
Nice.
Alright, so does this answer your question? Alright, so let's check the heart dissection. So how we're going to be doing the heart dissection? Let me first check the side of the heart that they've got for us. So we're going to be divided into 6 groups. So the group is going to be about 5 to 6 people. 5 to 6. Alright. So for each group, please get your gloves, your dissection tool, your tray, and your specimen.
Oh, that's the way.
Oh shit. I forgot my jacket.